Hello, my name is Dr. Dewan S. Raja. Today I will discuss about acute lymphoblastic leukemia, also called ALL or acute lymphocytic leukemia. Acute lymphoblastic leukemia is a type of cancer that affects the blood and bone marrow. It is characterized by rapid proliferation of immature and defective lymphoid cells, known as lymphoblast. These abnormal cells crowd out normal blood cells in the bone marrow, leading to various complications. Acute lymphoblastic leukemia is the most prevalent cancer among children and adolescents in the United States, representing 20% of all cancers diagnosed in persons aged less than 20 years or greater than 3,000 new cases each year. We have some key features of acute lymphoblastic leukemia. Key features of acute lymphoblastic leukemia include cell origin, or all means the acute lymphoblastic leukemia primarily affects lymphoid cells, which are a type of white blood cells. The disease often starts in the bone marrow but can quickly spread to the bloodstream and other organs. Rapid onset, acute, indicates that the disease progresses rapidly and requires prompt treatment. Unlike chronic leukemia, which develops more slowly, acute leukemia demands immediate attention. This is common in children. All or acute lymphoblastic leukemia is the most common type of leukemia in children, slightly more incidence among the male childs. However, it can occur in adults. Acute lymphoblastic leukemia, what is the cause? What is etiology? The etiology is unknown. Acute lymphoblastic leukemia may be associated with genetic mutation, chromosomal anomalies like Philadelphia chromosome, Down syndrome, trisomy 21, Li-Fraumeni syndrome, immunosuppressive therapy, and viral infection like HTLV1 or Epstein-Barr virus, EBV. Risk factors include previous use of anti-neoplastic agent due to any reason, maybe a treatment of Hodgkin's disease, non-Hodgkin's lymphoma, or some other type of cancer like that of multiple myeloma. Okay, so risk factors include previous use of anti-neoplastic agents. Environmental factors include ionizing radiation, toxins, that is benzene, or people exposed to nuclear explosion. Okay, these are environmental factors. Symptoms of acute lymphoblastic leukemia can include fatigue, weakness, frequent infections, fever, skin pallor, easy bruising or bleeding, pain, bone, fever, swollen lymph nodes. Okay, we put a comma here. Lymphoblastic leukemia include acute myeloid leukemia, lymphoma, any type of lymphoma, maybe Hodgkin's lymphoma, maybe non-Hodgkin's lymphoma, aplastic anemia, infectious mononucleosis, leukoid reaction, and multiple myeloma. Okay, these are the differential diagnosis. Then we'll go through the diagnosis. Diagnosis involves combination of blood tests like complete blood count, peripheral blood smear study, bone marrow aspiration and biopsy, and imaging studies like chest x-ray, CT scan, and ultrasound of abdomen and pelvis. The presence of an increased number of immature lymphocytes in the bone marrow or blood is a key diagnostic indicator. So we'll get increased number of immature lymphocytes in the bone marrow or in the blood. Subtypes, there are different subtypes of acute lymphoblastic leukemia based on the specific type of lymphocyte affected, B cell or T cell, and other genetic factor. The treatment approach may vary depending on the subtype. Acute lymphoblastic leukemia, this image has been taken from Robbins-Cotton Pathologic Basis of Disease, 10th edition. We are getting a lot of lymphocyte. Entire part is nucleus, only peripheral limb of cytoplasm. Okay, otherwise these all containing the nucleus. The cytoplasm is at the periphery, like that, periphery. So this is the lymphocyte, immature lymphocyte, densely thick chromatin, as well as very thin or small nucleoli, and peripheral rim of cytoplasm, feature of the lymphocyte. So these are all lymphocytes. These are RBC here. Okay. So here in normal blood cell, we are seeing on this RBC, we got some neutrophil or polymorphonuclear leukocyte. We have some monocyte. Okay, this is monocyte. These two seems to be immature. The lymphocytes here, this and this, but most of these are blood cells, RBCs. So if you go to the pathology, newly patient diagnosed with acute lymphoblastic leukemia, this is that. This normal blood cell is replaced by that of the lymphocytes. These are the lymphocytes. These all are lymphocytes. We have very thick chromatin dense nuclei. At the periphery, we have rim of cytoplasm. We have two small nucleoli. Okay, these are the features of the histopathology. Treatment of acute. Okay, so before going to treatment, what I'll do, okay, let me try here. We have diagnosis, differential diagnosis, then diagnosis, combination of blood test, bone marrow aspiration and biopsy, imaging studies. Okay, we got that. Now we'll go again to the, okay, so treatment, there will be chemotherapy. Usually it is a combination chemotherapy, central nervous system prophylaxis, because the cancer may spread through the nervous system. So we need intrathecal combination chemotherapy. Okay, stem cell transplantation, targeted therapies. Some targeted therapies specifically designed to target certain molecules or pathways involved in the growth of leukemia cells may be used. Examples include monoclonal antibodies like rituximab and blinatumomab. Okay, so these are the medications. Okay, we also need radiation therapy and certainly maintenance therapy. So we need chemotherapy, central nervous system prophylaxis, stem cell transplantation, target tissues, radiation therapy, and maintenance therapy. Okay. Prognosis of acute lymphoblastic leukemia. The prognosis of acute lymphoblastic leukemia has improved significantly over the years, specifically in children. Advances in treatment have led to the high remission rate. However, the prognosis can vary based on the factors like age, overall health, response to treatment, and specific genetic characteristic of the leukemia cells.